Okay, folks, we'd like to hear about the characters you played, how this experience might have helped you understand them better, to talk about how you felt in the group, how you felt about my leadership, and whatever else you want to talk about. Or if you want to ask me why I did anything that I did, I could try to address that.
You want to start?
Should Luke start since he started before?
Well, there's always that question, I guess, for the leader that, when do you look for more depth? When do you look to make sure you're checking in with people and sort of spreading it, around, so to speak? So, would you mind speaking to that a little bit and about how that unfolded for you during this session?
Mm-hmm. If there was a little more time left, I was going to ask Josh that he got quiet for part of the group, and then near the end you started talking more, so I was wondering if you felt overlooked or what you might be feeling.
Yeah.
I wanted to acknowledge the difficulty for a newcomer coming in and the difficulty for a group having a newcomer. I wanted to be a little provocative when I said, Aparna thinks you're a bomb, you could be a bomb, to bring that out. But I thought the group was doing so well that every once in a while I could be like a sheepdog and, direct things. But I thought what was going on was good. So I think sometimes a group therapist can feel overly responsible for what's going on rather than getting the group to address each other. And especially in this kind of forum where I'm supposed to be demonstrating something, there's additional pressure to say more that I try to resist, at least for me.
Mm-hmm. And I could feel like at the beginning it seemed like obviously I was a little bit of an agitator, right? But it felt like a old versus new kind of dynamic or something there. And we went there, but then it felt like gradually it opened up in a way where it was more, I don't know, felt like peers in a room, if you will, as opposed to at the beginning. Everybody kind of got a little bit more space. The space kind of evened out, maybe is a better way to say it.
I thought as a newcomer, even though things got a little more, seemed okay as the group went on, I could see where a newcomer would be left with concerns about, am I really welcome here? And that's why I asked you whether you wanted him to stay. And I asked you how you decided to share information with a guy who might leave, given that you'd been left a few times. And so I wanted you to hear that at least one person in the group wanted you to be here.
And I was surprised that my character identified with Luke's character. I wouldn't have expected that to be the case, but perhaps this is part of his character, or maybe it's just spontaneously, but besides sort of being a jerk sort of character, there was something subtly charming and just like something endearing about his character, and I think that's what my character identified with and led to my character wanting him to stay.
Well, I think you identified with his rejection, or feelings of rejection, and that it seemed pretty evident when he kind of got quiet. And
Right.
Sort of, it seemed like he wasn't disagreeing with you, at least.
Right.
Yeah.
Normally I would have thought that my character would have found it sort of disingenuous, coming from someone with a lot of the flashy sort of qualities, but I bought that he was may actually have feelings of rejection or had feelings beyond just his surgical prowess or what he tried to tell us about.
And I was feeling the exact opposite, right? Because I think that's why I became more quiet as it went on. Like the more he talked, the more my character just hated him. Like, he was, like without a job, raised more like in the rough environment, working construction. You come in and can't stop talking about your watch, and you know what I mean. Like everything else that came out, it was just like stop talking, you know. And then with that, I was talking at the beginning about how when I go down that road and I'm agitated, then it gets out of hand, and so I just backed off and quit engaging with you.
So I could have asked more about your being quiet, because you can learn as much about why someone's quiet as why they're talking.
Yeah.
You know.
Right. And the same with her. Like when we brought up why she's quiet, a lot came out.
With Luke's character again, I think my character took somewhat of a risk in that she mentioned before that she finds kind of like these charming people to be difficult to talk to, or may or may not be genuine, and so I took a risk here believing that this surgeon, flashy surgeon character to be genuine, though, you know, depending on if he were to show back up at the next group or not, you know, there might be a loss that I would have to process at the next group for opening up so much.
And your character also said, like, about both Josh and Luke, that they seemed charming, like the types of guys that you would want to date. Or...
Right, but then, so I'm saying my character, you know, would normally be afraid
Yeah.
to
That's gutsy.
approach or talk to them or open up to them in any way. So that was
why I asked you how you decided to share more about yourself with another guy who could leave. And one of the meta communications there is we're all making decisions every millisecond. And to bring out that phenomenon in a group, how people are deciding what to say or not to say. Because somebody in my group once said, you know, I feel trusting of everything people say in here. What I don't feel so trusting about is the things that people think and don't say.
What I was going to say, I think that whole theme of like honesty being, like it was interesting because I think that comes up a lot in groups, you know, in individual sessions, but over time, this presumption that we're all here to be honest, we're all here to be open and vulnerable in a way that we aren't or cannot be in the world at large, and yet there are still those like boundaries and barriers, and there are times where you bump up against them in a group in what can almost feel artificial, but at the same time, it's like it's important to maintain those things for safety. And so particularly towards the end when we were talking about honesty, there was a part of that where it was like, well then what do we do with this stuff if what we're saying about it is wrong, but it's wrong to not say anything? Like those kinds of things, moments seem to come up a lot in group therapy, and I imagine as a leader also that's kind of a real key point to help not diffuse, but right manage the...
I think one of the reasons people have trouble being honest, and it takes them a while to realize this, is what they're afraid of is their own judgmentalism. So they're afraid how it's going to come out, either too harsh or by reaction formation, nicey-nicey. And it takes work for people to work on their own judgmentalism so they can just feel freer about what they say.
And I think with Bob too, sometimes people will share things where it's like they yes, there's courage in these things involved in actually getting to that point where you open up, but at the same time, there is something that is wanted in return, and it may not be defined for anybody, but then it can be this sort of feel dropped, feel rejected, feel, you know, if it's not handled the right way. So it's not just that simply being honest has its own inherent reward, right? But if you're not getting back but finding the language for that, I think one is individuals in a group, but for the person who's even choosing to take the risk.
Well, the other thing in group, or anywhere, but especially in group, is anytime A says something to B about B, A is saying something about him or herself. And as that awareness grows, there's more restraint in a group because people are aware that you cannot not self-disclose. So that's a very powerful thing.
Do you feel like that as a leader too?
No, because one of the things I love about group is that it's so complicated, it's impossible not to make mistakes. So on my better days, I want to hear what people are thinking or feeling that I'm not doing so well, because I could learn something. So I think in the beginning, when I first started doing it, I was more concerned about what I might be revealing, but after 44 years of this, if I can't learn something about myself,
I was surprised at how much the group moved around, honestly, because in my group, this is my first year doing group, it's usually really kind of sticks to one or two people for the entire time. And we don't get this kind of jumping thing. So I thought that was pretty good that it managed to keep flowing like that.
one thing I didn't have to do in this group, but I often do in my groups, is if people start firing questions at one person, I will say to the questioner, could you add a self-disclosure with that?
Mm-hmm.
Because if they're so engaged to ask these questions, something's getting stirred up in them about what they're asking the question about. So I say, could you add a self-disclosure to that?
I mean, I really did feel like that there was kind of a rhythm to this group, though. You know, in the beginning, I was somewhat engaged. As my character knows the harm that he might feel or the encroachment that might come from a new member, and he feels protective of his group. This is a group that he's gotten really comfortable with. But then as people started getting comfortable with him, he felt out of place then. And he kind of felt like, okay, well, they like him now. I still don't know. I'm just going to sit here for a little while. And only at the very end, when there was something I could really connect to, then I feel like there was any part for me to be in the group. For the middle part, I felt like this was a waste of my time. That there wasn't,
if it's not
for my character, there really wasn't anything there. There was no,
about
yeah.
you.
Yeah, and it really, that's what it is. I think it's just that sensitivity that he has, and needing to feel needed in the group, or needing to have a place, but not having one.
And I felt like when my character asked your character if we should just ask you every time, I felt like that you didn't receive that very well, because it was upsetting to you that that we would just kind of reduce it to a procedural thing, and we wouldn't be sort of monitoring how your moods were or how your reactivity was. And so that was also something that was interesting.
It was an odd experience for me. I mean, I know parts of my character come from patients that I've taken care of or people that I've worked with. And when I started to use that as kind of, items or things to fuel the group, there was my own emotional experience that I've had, like in the frustration with Anne that I had, and then when y'all were saying things about kind of procedurally, what should we do with you? I didn't know the answer either. I felt very hopeless, and I'm assuming that's what the people I work with feel like too. I'm assuming that that's their own experience too. They just know how they feel at that moment. That they're being hurt, they need to do something. But also just being in a hopeless situation where they don't know. Hence,
You did a good job of portraying like this confusion and vulnerability, but it was really frustrating. I felt
that's,
very engaged with your character, but frustrated.
And it's odd because on the provider side, I get that frustration too. So I know where you're coming from, and then on the side of the patient, I felt very helpless. I felt like no one understood me, and that they were going to continue to hurt me.
And you didn't understand you.
I didn't understand me. It was,
Right.
Yeah.
So that's the key is we didn't know how to help you because you're here trying to figure out how to help yourself,
Right.
and you don't know the answer.
Right.
So Dale, did you want to open it up to?
To the audience? Yeah, I mean, the question I had was, I started to think about the relationship of anger and shame. I was thinking about Bobby's character, and that he has some shame about the cutting, and but some of the anger he was feeling in the group, I was thinking maybe it was helping him to get at the shame and be able to talk about it. So I just was wondering what you thought about how anger and shame might be connected.
Well, actually, I wasn't thinking about it because I felt, I know you had them read the papers, and I hope they got something out of it, but I felt if I was thinking about those things, I would be losing touch with what was going on here. So I just decided not to focus on those things unless it occurred to me to. Because I thought it would have been imposing something on what was going on here that would have disrupted the genuineness of it. So I appreciate all your efforts in getting them to read those, but that was my process.
What about the issue of courage in this group? Can you make some comments about how you saw that come up in this group?
Well, I thought as a new person, Luke, now I don't know if, courage, you can't assess whether something's courageous from the object nature of it. You have to know what the fear is a person has internally and what fear they're overcoming by what they do. So if somebody comes from a violent home and the group starts fighting and the person is able to sit in their chair and not flee, that's probably courageous. But, nothing was actually said. Whereas if what Luke did was egosyntonic with him, then that wasn't hard for him to do. But I'd have to know more about you to know whether the way you entered the group was courageous. There was one woman in my group who, when she first came in, had no problem, saying all kinds of angry things to me, but as she got more connected to the group and me, she couldn't say those things because now she was afraid that she would lose me by expressing that anger. For her to be angry in that phase of the group would have been courageous, but not in the beginning, because she could be very angry at people she wasn't connected to. So, I thought maybe when you talked to Luke that was courageous for your character. Seemed risky. Did your disclosures at the end feel courageous?
I was definitely very nervous and scared while I was saying.
Yeah.
Yeah.
I think at the beginning too, when you talked to him very directly about what you were thinking,
Yeah.
it seemed courageous for your character.
Yeah, at the beginning when you kind of talked, which were very direct with him, it seemed somewhat courageous, but also like maybe a little bit of a defensive front, with this unknown character sort of showing up.
I mean, there's that sense that this group is my group.
Yeah.
Yeah,
And so,
which you mentioned.
I feel safe with y'all, and there's this new person here, so I can. And then when he asked, like, what are you guys feeling or thinking right now? I remember at that moment, that's what I was thinking. I kind of don't like him, but I kind of might be all right. So, yeah.
Was there a part of your character that, wanted this guy to be really unlikable, and so we could get rid of him and he didn't come back to group?
Who knows? Maybe that or the total opposite, someone that I could really grow to like, or someone that would be a lot more supportive than what I felt like I got in the group.
It was true. I mean, it was like, for me, it felt like I was, coming into an unsafe or foreign kind of environment, right? Okay, so here's a guy, I kind of played off on old stereotypes, of course, but, insecurity, overcompensation, the narcissism thing. But then I realized, like, as you guys were like, well, what are you here for? Then it was like, there's going to have to be a point where there's some vulnerability or something. And the idea that they were already in a group before, that this wouldn't be a completely foreign concept, but still that those initial instincts to sort of be like, puff my chest or whatever a little bit. So
It might have been courageous of me if I said, what's it like for this group to have this uppity newcomer come in here and tell us how we should be running the group, how the group should be behaving? Or
The ghost of Richard Billow.
yeah, I meant to talk to you. Richard
I
Bill,
understand what you mean, Jerry, about not wanting to impose, and I wouldn't want to impose either. But post hoc and being outside the group, you could almost conceptualize the group as a shame group. I'm thinking, a new person's coming in, and a lot of times we have worrisome, shameful feelings about when we're joining, And you know, you think about Anne's shame about her angry, negative feelings, and Josh's shame about losing the job, Bobby's shame about cutting, Natalie's shame about the divorce, Aparna not dating, you know, for so long. And then with Luke, you kind of think about shame being the underside of narcissism. And so there, that theme is there. I'm not sure what to do with it other than think about it afterwards and think how to work with that in the group over time. But do you think like that sometimes and think, okay,
I thought if I addressed the shame involved in their histories out there, it would have lost emotional intensity. That's why a lot of my comments were process comments about how people were interacting or wanted each other to be. But I thought it would get very heady if I stayed with it at that level. That's what I was hoping to demonstrate. At one point, I think this is another point, when the leader has associations and then either the group passes by when it would have been appropriate to say it, or whether the leader realizes saying it would be more for his or her benefit than the group's benefit. For example, at one point, I had the association when our third daughter was born, the other two suggested that the new baby could fit in the garbage compactor. You know, so I was going to say something like that to the group. You know, I just had this association. But then they moved on, and I thought if I said it then, it would be showing off. You know.
Or competing with Luke.
Yeah. Yeah.
Yeah, it was interesting in that we sort of did, I guess, you know, he does have some good surgical managerial skills because we sort of did follow along with a lot of his advice for the group and the way it should be run, whether we were cognizant of that or it just sort of fell into place in some ways.
Yeah, and that's not character, that's me.
Okay. Second career, surgery. Third career.
You were surprisingly nice, or your character was surprisingly nice to me, though, after you asked me what was kind of going on with me. I was expecting you to be more pushy about it, you know.
Yeah, well, I gotta say, your emotion in those moments there was
It's very
almost
real.
top notch. Yeah, I mean, I genuinely in that moment I felt sorry for you, for lack of a better word. I mean, but I really
Yeah.
empathized with what you're saying, and I felt like I wanted to retreat. You know, no, like I would kind of poked, and then you said that, and I was like, oh my god, I felt like I just stepped in something awful, and just felt like I'd really done you wrong there. So
That's exactly how it feels in my group.
yeah.
Yeah.
You know, one of my concerns about running the group was that we're telling people, look, you already had a first meeting. Now in the second meeting, act like you're a group in the middle phase of a group.
Mm-hmm.
But actually, I think it felt like that, which was extraordinary.
so it felt like a mature group in
Yeah,
a sense.
yeah.
It did to me too.
I'm kind of curious if, I know part of you talked about having a little more insight into your character. So I'm wondering what you've learned about, we ask you to kind of channel a composite of some of the people you've worked with, and what have you learned, or what are you going to take away from this experience?
Well, so I think with mine, it was more than one group member that I was relating to. They are very sad, and I think just I used a couple of words that maybe they've used before, and just saying those things and kind of hearing that and having it come out of my own mouth, that is really, really like this despair, and to feel just lost. I didn't know what my character wanted or needed in that moment, which I think is kind of how the group ends up feeling, too. And I think it really does give me a new perspective, kind of going into group, because I know at times I even felt frustrated. I felt frustrated with some of the patients being that sad in group because it kind of brings down the whole group. So like everyone comes in feeling pretty happy, and then this person shares that, and then you're just like, well, now it's going to be downer day. And I can feel myself not wanting it to be that sometimes too, and I think it's important to really get that full sense of empathy in the moment to know kind of exactly what that's like.
I have to say for me, it's that frustration that a provider feels, I felt it a lot. I have a tendency for patients or people that I work with to want to get better. And I know when I go to supervision, I bring it up a lot. I'm like, what can I do next to make this person get to the next level? And when they're not getting better, or when I seemingly think that they're not going the direction that I want them to, I do myself have a lot of frustration with that. And knowing that and kind of being able to touch in on the fact that it really comes from that central place of hopelessness, and that's what the patient themselves are experiencing, I think that's been helpful because it's a scary place to be. Not knowing what advice to give or what to say or how to even help yourself. So.
I guess just listening sometimes.
Yeah, I guess that's the best that we can do.
Yeah, I think that for my own self, so there was a lot of things going on in my head. One, my experience in our own residency T group as a member over a course of years. Another sort of personal, experiential group at a conference where it was a process group, but it was strangers and it was foreign and it was scarier in a way. And then leading group, right? Kind of, and then so it's like these multiple lenses, if you will, about what's going on here in this moment. I so wish I could shed the leader, the intellectual one, and just, But I think that the thing that has struck me by is it's so good to be in tune with both sides, of course, particularly when you are the leader. I found myself trying to, it's like you want to dial up the affect in this setting, whereas I think a lot of times when I've been in those more authentic, real group member situations, it's like you're always figuring out how to filter what you're trying, even if you're being your true self, like there's just always some sense of, okay, I want this to come out the right way, you start thinking about what words you use or just doing whatever you need to do to calm down just enough so you can get it out there in a kind of a coherent way. Here, and I think that probably from that leader role, it's more just trying to like get the affect up, and so I don't know, maybe both are helpful to be thinking about simultaneously when you're kind of in the room like that.
I also found it interesting that in my character, for example, I sort of had a vision of the way in which I was going to go with it, and then based on what other people in the group said, my reaction was actually rather unpredictable, I guess, in comparison to what I thought it would have been. So it just kind of showed, I guess, as far as within a real group, that people aren't so black and white, and we all kind of had a certain emotion or type of person we want to channel, but we sort of ended up all becoming a conglomerate of the different emotions. So.
How did it feel to be so angry, Anne?
Yeah.
I think I felt, compared to our previous rehearsal, I felt more sadness. I just felt like I want to connect with people, and nobody will connect with me. Like nobody will talk to me, and
No one will connect with you in your anger.
yeah.
But that's why.
Nobody will get,
that's
like,
why your
excited
character
and,
is
like,
here,
yeah,
right?
and
Like you don't have that conflict at home.
Luke
that you want.
was promising that. Yeah, no, that's what I want. Yeah, right.
It is.
'Cause
I mean,
at home
like
it's
at
like
home you have it's all flat, and like
I
you
have
try to
to-
raise some anger, and
I
it's
have
not
to
there.
be nice and
So you're having the same problem here
smile
that
and-
you have there.
yeah, and so I'm really not able to open up here that much more than I can at home.
But it seems important that you got in touch today with that yearning, the sadness. This is really important.
Can you talk about, from a group leader standpoint, working with Anne's anger, kind of how much you let her hold that role for the group and kind of enliven it in a way versus, if it were just individual therapy especially, I think there would be more of a direction of trying to, see anger as a defense or kind of whatever other negative emotions are there, but it felt a little different in a group.
I guess my style is often to do it indirectly, So I might ask the group, let's say Anne's involved in exchange with somebody and she's angry but she's smiling. I might say to the group, how did people experience that exchange? And if nobody commented on the disparity between her feeling and her facial appearance, I then ask the group why they did anybody notice that? And usually people had. And then I would ask them why they didn't say anything. And then that might bring out their feelings toward Anne and what they're afraid talking more directly to her might result in. So that would be one way I do it, because I think taking it on more directly might shame the person. So if the group talks to her, assuming they do it in a more gentle way, then I would feel like that I've called attention to it, but I've had the group help her, and I'm less likely to be in the projective field of her negative feelings for me attempting to get at that.
Put the other person on the spot, not Amy. That you've invited them to comment about their emotional reaction to it, and not Anne. So that helps her sit with and not feel
Yeah.
like she's shamed.
Also, when I feel like people are really angry inside, I often don't engage them one-on-one, because if I do, then I get them to attend to me, and projections follow attention, and people tend to believe their projections. So if you're angry and I'm bringing it out and I get you to look at me, I start to look angry, because as you project that stuff onto me and you believe it, then I seem dangerous. So I'd rather have one of 7 other members in the group maybe seem a little dangerous rather than the leader. So that's the thinking that's going on for me.
Dr. Gaines, you mentioned that comment you made to Aparna about it could be a bomb. I'm forgetting the other times, but do you occasionally use a bit of humor too to lighten? Not with intent, but it seemed like there were times where your comments were sort of lightening in nature.
Yeah, I use humor. It's a delicate tool, but especially in the mature phase of the group. Like, I like to tell jokes, and I have, as I get older, there are not many things I remember, but mostly what I remember is jokes, and so I have access to these jokes. So if the group is really angry, but they're acting really nice, I say, it reminds me about the fellow who was having breakfast with his father, and he meant to say, could you pass the salt? Oh, he was telling his friend he made a Freudian slip, and the friend said, oh, what was that? He said, I meant to tell my father to pass the salt. And instead I said, you bastard, you fucked up my childhood. that usually loosens things up.
When you said Aparna might be a bomb, were you making a double entendre? Like she could both blow up and be a sex bomb, bombshell.
I was just very confused by the whole thing. I was like, no, I'm not a bomb in various ways. Please don't search me at the airport.
No.
So you went there with kind of a racial thing, almost, right?
I like jokes.
I'm sorry, what?
I like jokes, so I hope when I'm your age, I will have access to many jokes.
No, I think the reason I said it is I've been impressed sometimes in a group where someone is very depressed, and the group is very solicitous and, oh, I'm sorry. And part of me thinks they don't mind their being that way, because the other side is they might be a bomb. And so I want to bring that out. And so I'd like to make provocative comments, and if I'm wrong, fine, but if I'm right, it takes the group often to a deeper level. Speaking the unspeakable. just for my own education, I shouldn't say just, for my own education, were there any things I did that hurt people's feelings or anything you wanted me to do that would have helped you out that I didn't do?
See, sorry. There's only so much space, you know, right? So it didn't seem like the way it flowed that it necessitated a ton from you. That's not to minimize what you. There was at the end when the cutting stuff was really the center of attention. I felt like collectively we were struggling a little bit about how to navigate that. You sort of just let it go, which. I don't know if you want to speak about that or not, but that was one thing where I felt internally a sense of pressure about like what is happening here, where are we going?
Well, there were two things there. I was trying to figure out when 60 Minutes would be.
Yes.
And then I didn't want to open up something that we'd have to stop. So sometimes that can re-traumatize somebody to bring it up, open it up, and then, sorry, we have to stop. So that's what was going on in me.
Mm-hmm.
I think I had a similar question actually for my character because in our group it's actually when suicide has come up it can be kind of a stop in the group and so in knowing what to do with that or not. And I think that my character ended up saying like I'll be good and everyone was like all right she'll be good. And so I just kind of wonder I never really know how to navigate that very well. I mean,
Right, I did say to you, you've told the group not to worry about you, but it seems like they do care.
mm-hmm.
So I didn't want to let that remark go by, don't worry about me.
Yeah. Yeah, it was good then to open it up to everyone else.
Yeah.
I guess would that have been more of a group, the group leader would have kept you after a group and make sure, or, because it sounded like we were, it seemed like we were somewhat reassured we didn't continue on that topic. We moved to different topics.
Mm-hmm.
So do you usually, like if you have a patient like that, do you like talk to them
In my
after
group,
or anything like that?
We talked about it more at length
Okay.
and kind of talked about safety more at length than that was the first time it came up. When I think about now, when it's come up again, it's been less on the safety because we sort of talked about the safety, kind of 911 or call the pager sort of protocols, and then after the fact, I think it has ended up being more about other group members just talking to that person about how they feel about them and checking in, and that's been probably more helpful because I think that's actually what the group member is looking for.
Because what I think they're really looking for is a chance to normalize the experience. I mean, everyone has stresses that they deal with, people not being able to have a boyfriend or be in a relationship, and for the person that cuts to the person that feels depressed and feels suicidal, that's just one more stress that they have. And shying away from the topic and treating it like something that's, oh, let's talk about safety because you brought this up. It seems like you're skirting away from the actual issue at hand, which is just that this person has a difficulty.
Mm-hmm.
We're running out of time, so I wonder if anybody has anything they need to say, would like to say before we stop.
As yourself or as your character?
I really enjoyed it. Really a pleasure to
Yeah,
have you here.
it's very cool.
Thanks to all the residents for your willingness
Yeah.
to participate and be on camera.
Right, and I'd like to thank everybody for the privilege of being able to do this.